Hi, I'm Mike Taigman. I am the improvement guide for First Watch, also an assistant professor at the University of California, San Francisco in the master's degree program in healthcare administration and interprofessional leadership, where I teach improvement science. I am also a adjunct professor at the University of Maryland, Baltimore County, in the master's program in emergency health services management, where I also teach improvement science. And I'm also the author of the book Supercharge Your Stress Management in the Age of COVID-19. And I am here to talk with you about employee wellness. There are a lot of different aspects to employee wellness. For this session, I am going to focus on stress management and helping deal with what is a stressful job and a stressful role. And we'll talk about kind of the leadership aspects at the end. And more details are available in this book, Supercharge Your Stress Management in the Age of COVID-19. But to just kind of frame this, I want to tell you a story about back when I was a street paramedic. It's been a few years ago. This was the early 1980s. And my partner and I had just dropped a patient off at Denver General Hospital. And we got one of those calls that you hate to get as a paramedic for an officer down at 40 South Pennsylvania in Denver. This is a shot of the front of the house at 40 South Pennsylvania. In the yard in front of the house was this sign. This house has been harassed by the Astro Hole Division of the Denver Police Department for the last 20 years. There was also an upside-down American flag in front, which is an international symbol of distress. In this case, probably psychological distress. But the woman inside the house had called 911 and said she was afraid that her drunk husband might kill her. So a patrol car was sent. Two officers and a rookie officer, Officer James Ware and his field training officer, responded to the house. Now these are daytime photographs, but this call happened just after the sun had set, so it's nighttime. And as Officer Ware and his partner pulled up in front of the house, they looked up to the house and noticed behind the screen door a man with a long-barreled weapon. Officer Ware deployed out of his patrol car and took up a position of cover behind this 4-foot-high concrete reinforcing wall. You can see the house was up on a little bit of a hill, so a little bit of high ground advantage in this position. The guy in the house started shooting at the officers. Officers were returning fire, got on the radio and said shots were fired. So other patrol cars from across the city were responding to the scene. And as Officer Ware looked up over the concrete reinforcing wall to return fire, he took a shotgun blast to the forehead and was dropped to the ground in front of the concrete reinforcing wall. Call went out for an officer down. We were only 4 blocks away. My partner and I responded and took up a position of cover behind this 4-foot-high apartment complex at the end of the block, and did a little quick peek out the edge of the block here. Several other officers had arrived on the scene. Active gunfire going off back and forth. I saw my friend Sergeant Ron Sampson, who was the district sergeant for this area of Denver, parked down at the far end of the block. And he was working his way along the houses trying to get to the downed officer, and just as he got close, he was shot in the chest with a 12-gauge shotgun blast and dropped on the ground next to Officer Ware. So now we have 2 officers down in the middle of a very active gunfight. Officers are arriving from all over the city, some of them kind of wild-eyed with panic in their eyes, others very cool and calm and collected. One of the officers got on the radio and said, hey, the lights from the street lights and the front porch lights on people's houses are backlighting. Officers making us easier targets for this guy. So all the panicked officers on the scene and at the same moment all shot out every single one of the street lights and front porch lights up and down the street, and a cacophony of gunfire and shattered glass. Shortly after that, the Denver Fire Department arrived on the scene along with the Denver SWAT team. SWAT team commander is one of those cool, calm, collected kind of commanders. And he got with me, and we hatched a plan to extract the downed officers. We used a shield from the SWAT team, ballistic shield, put it in the driver's compartment of the pumper, and my partner, myself, two EMTs from the fire department, and the SWAT team rode on the far side of the pumper as it drove down the street into the middle of the gun battle. The SWAT team commander said, "We will give you 30 seconds of nonstop automatic weapons fire into the house to give you time to extract the downed officers." And he did a 5, 4, 3, 2, 1 go count, and they lit up their weapons, and we went in parallel to the gunfire, grabbed the two downed officers, drug them back behind the pumper, and then backed the pumper back down behind the apartment complex where another ambulance had arrived, and we split up the two officers, one in each ambulance, and headed to the trauma center at Denver General. Officer Weir did not survive his injuries. Sergeant Sampson, cardiac arrested shortly after, transferred to the bed in the trauma center at Denver General. They opened his chest, repaired his heart, and restarted it, took him to the operating room. He was able to survive, was discharged alive, went back to work on the streets in Denver, and retired several years later, and now runs an antique store in the mountains of Colorado. But I got curious about, what is it about some of the officers that show up and are cool and calm, and others show up with panic? What's the difference there? And they brought in the whole critical incident stress debriefing process with psychologists and peer support people and all that. This was right when that stuff was just getting started in our world. And I went to all the sessions, and I was sad. I mean, I was certainly sad for the death of the young rookie officer, and sad that my friend was still in the ICU recovering from horrible traumatic injury. But I was able to recover and go back to work on my regular shift. Other people had to stay off work for a couple of days, and there were other people there were two officers in particular who were so seriously psychologically injured that they never came back to work at all. So, what's the difference between the two? And the difference really is resilience and stress management techniques. And as you travel down the road of life, resilience are those psychological and emotional and physical strength that you build before you get into a stressful situation that helps you deal with the stressful situation more effectively. Stress management techniques are those things that help you manage stress in the moment. And then on the far side of it, if you end up with a problem or psychological injury or PTSD or something like that, there's all kinds of trauma-informed therapy like exposure therapy and EMDR and cognitive behavioral therapy that helps people on the other side of the situation. So for this talk, we're going to focus on the stress management part. And I just ask you, as you're watching this, what causes you stress? And as I'm recording this, we're in the height of the coronavirus pandemic, and I think 6 months ago when I was in the grocery store, if somebody sneezed or coughed, I probably wasn't even aware of it. But recently, I was in a grocery store, and there was a woman with a surgical mask on, and she did the getting ready to sneeze and pulled her surgical mask down and sneezed in the produce section over the organic Honeycrisp apples, I'm sad to say, and then put her mask back up afterwards. And that caused a collective level of stress that was surprising for most of the other shoppers there. So you can ask yourself questions and ask questions of your team members. Are you finding yourself getting upset by little things these days? Are you noticing yourself overreacting to some situations? Have you been more irritable? Have you noticed that when you get upset, it takes you a little longer to calm down than it used to? And this is why you need some stress management strategies. And there are a lot of time-honored good advice around stress management. You should eat healthy. You should exercise 30 minutes a day and get your sweat on and get your heart rate up a little bit. You should get plenty of rest. Adults, according to the American Academy of Sleep Medicine, need 7 hours of sleep, including at least an hour and a half or so of deep, restful sleep. Should try to avoid caffeine for your stress management, and socialize, of course. This pile of recommendations is a little bit less available during coronavirus, but hopefully they will all come back fully on the other side of it. And when you think about stress management techniques, they are things that you need to be able to have activated in your system so that you can act on them automatically. They can't be things that you have to try to remember how to do. They have to be things that you can just kick into and use automatically. So a quick review of your brain system and how it works is helpful here. So this is your brainstem on a PowerPoint, on a video that you're watching on your computer. Some of you are old enough to get the old joke reference there. Brainstem essentially differentiates you from a head of cabbage. It encourages you to breathe, regulates your temperature, helps monitor your heart rhythm. The next part of the brain to evolve is your limbic system. This is the seat of all of your emotions. Love and joy and happiness and sadness and frustration and depression and all that stuff happen in the limbic system. The neocortex is that thinking part of your brain, that outside edge of your brain. And from the stress management perspective and the wellness perspective, the prefrontal lobes of your neocortex are a key part of what you need to pay attention to. They're also known as the executive center, sometimes called the smart brain, right behind your forehead here. And they're involved in being able to understand maps and make maps of the world and how it works in your brain, and exercising impulse control and those kinds of things. Inside the center of your brain is the thalamus, which works like the 911 communication center from your brain. It takes in information from your optic nerve and your auditory nerve and your proprioception and all the other parts of your senses, and routes them to different parts of your brain for analysis and possible action. And next to your thalamus are two little pieces of almond-shaped neurologic tissue called the amygdala. And the amygdala, when you understand it, it is a very powerful concept in neuroscience and leadership and taking care of yourself. Your amygdala is your body's lifeguard. It's your sentry. It's on duty 24 hours a day, 7 days a week, 365 days a year. It is constantly asking 3 questions of everything it interacts with in the world. Is this something I can mate with? Is this something I can eat? Is this something that is likely to eat me? And if it gets a no answer to these questions, it does nothing. But if it gets a yes answer, it activates a cascade of neurochemicals. So if the answer to the question is this something I can mate with is yes, it activates the parasympathetic nervous system response, also known as the relaxation response, and it inspires the emotions of love and joy and happiness. On the other hand, if it gets a yes answer to the question, is it going to eat me? It kicks off the old sympathetic nervous system, the fight, flight, which is what most of us learned in elementary and junior high school and EMT school. We've since learned it also can cause you to freeze or, in some cases, faint. And everybody has kind of a different level of activation of that system. Some of us really can go through a lot of stressful situations and not have our amygdala get activated and be fine. Others, it just takes a very little bit of stimulus in order to kind of trip it. And we all mammals have some level of this system to help us identify and act on certain threats. And human beings also have this, just like other animals. We're able to recognize threats, and it's part of what helps keep us alive. The problem with human beings is we have these big brains, and these big brains not only can identify threats just like other animals, we can imagine threats that don't exist. We can continue to replay threats that have passed. We can spin out on all kinds of things, and this causes us distress. And this stress, poorly managed stress, causes inflammation in our cells. That is the root of a whole bunch of different diseases and disorders. So inflammation, oxidative stress, damaging the mitochondria within your cells, shortening the telomeres, which are part of your DNA, that are a contributor to aging, all work together to cause high blood pressure. They're the root of obesity. They contribute to diabetes, heart disease, strokes, all different kinds of cancers, over 100 different autoimmune diseases. And from the psychological and emotional perspective, they're the roots of depression, anxiety, burnout, compassion fatigue, post-traumatic stress disorder or injury, depending on which one you want to call it. And they set people up for suicide. And in the EMS world, we know from lots of research that we experience these things more than the general population by a significant margin. So the question is, what do you do? How do you take care of yourself in a world where you have the potential to have your stress activated from a number of different things? One is you can do nothing and just suffer, which is, may end up causing you to have a crippling psychological or emotional or physical injury on the other side. Some people use a maladaptive response to stress. Since coronavirus has hit, at least here in California, alcohol sales are up 55%, which is an indication that people are stressed and they're treating it in a way that may hurt themselves. Some people can just try to get away from the stressor, which is a reasonable thing if you want to leave the industry or something like that. But the part that works most effectively is to really focus on changing your brain and changing how you react. And there are a whole pile of neuroscience-based strategies that you can use to quickly and easily change your brain. And I'll just share a couple of them with you. One of my favorite examples is I have an 8-year-old son, Axe, who loves eating penne or rigatoni with marinara sauce. He likes a lot of marinara sauce. And one evening he was eating in front of the television, which I know is bad parenting, but we do it a fair amount anyhow. And he still had about half his bowl left, and he was taking it back into the kitchen, and he tripped over one of his mini Legos kind of falling and launching his leftover dinner. And my wife, Sasha, was standing right there, and I saw her face as this kind of Jackson Pollock-style Rorschach of marinara sauce starts to fly out of the bowl. And you have to know my wife, she likes white furniture. We have white sofas, we have white club chairs, we have a white dining room table, we have white paint on the walls. And she's seeing this spray of marinara sauce launching on all of her white stuff. And she's been working on her stress management stuff for a while now. And I saw that initial look of kind of horror on her face, and she kind of caught herself, and she muttered under her breath, she said, "What am I really feeling right now?" And labeling your emotions in the moment is a powerful stress management strategy. And she said, what I'm feeling is surprised. And she said to our son, Axe, she said, "Axe, I'm feeling surprised. Are you feeling surprised?" And he looked up and it was like, "Mom, I'm surprised that surprised is the word that's coming out of your mouth right now." And she said, "Well, let's just work together to clean this up." And I was like, 6 months ago, before she'd started working on these techniques and strategies, that would have been an angry mom and an upset little kid. And there's a huge amount of interesting neuroscience that says if you can just label your emotions in the moment, it will decrease their impact and hold on you from a stress perspective. Another one is during the course of your day, to make sure you take times to just pause for a moment. Research shows that it only takes about 90 seconds to kind of dial down an activated stress response system. So if you're like a coffee drinker, a hot chocolate drinker, a tea drinker, or whatever, when you're pouring yourself a cup, put your phone down. Don't look at the dispatch screen. Don't look at your television. Don't look at the newspaper. Just for 90 seconds, pay attention to your coffee. Smell the aroma of coffee. Let the aroma kind of fill your nostrils. When you take your first sip, enjoy the taste in your mouth. Let the warmth of the liquid warm up the inside of your mouth. And when you swallow that, feel that warmth kind of go down into your system and feel your hands around the cup getting warmed up, and just really be there for a moment and kind of enjoy that strategy. It is a really helpful technique for kind of dialing your nervous system down. Another one that is really helpful, and I've got dozens of these. We're only going to go through a couple of them here, but one of them is the practice of gratitude. And there's great neuroscience that says the practice of gratitude really helps dial your stress down, nurtures your resilience, improves your joy and your happiness overall, and really decreases your anxiety and depression. A lot of different ways to practice gratitude. One of the things that we do as a family is before we go to sleep, we'll do the 3 gratitude list, where each of us lists 3 things that we're grateful for during the course of the day. And there's actually research that shows that it helps you sleep better if you do gratitude practice just before sleep. With the coronavirus pandemic, it's a little disturbing to realize how many people have just discovered hand washing like it's this new thing. But if you've been a hand washer for a long time, or you're new to it, however that works for you, you're supposed to wash your hands for 20 seconds, and that recommendation is always to sing the happy birthday song while you wash your hands to give yourself the full 20 seconds. My son likes to sing the Baby Shark song, and I apologize for those of you that will have the Baby Shark song in your brain now, because you won't be able to get it out of your hand. But one of the things I do when I wash my hands is I do a gratitude practice, where in my left hand, I think of something that I'm grateful to myself for. And the practice of self-gratitude is really powerful. You don't have to tell anybody about it if you're embarrassed about it or whatever, but just something you're really grateful to yourself about. And on the other hand, I think of something externally in the world that I'm grateful for. And, as I was washing my hands, getting ready to come in and record this video session for you, one of the things I thought about is I'm grateful to the folks, Linda Hall and team, for putting this video leadership series together for all of you. And I'm grateful to all of you for watching this and really learning and enhancing your own leadership skills. So if I work on thinking of a different thing I'm grateful for in both hands every time I wash my hands, I'll spend the 20 seconds washing my hands so my hands are cleaner, and I'll be doing a gratitude practice. And many of you watching this are leaders. So when it comes to practicing leadership, it's really helpful to remember that your limbic system, we show it in these pictures as if it were encased in your skull. And the limbic system is actually part of your mind, which is bigger than your skull. There's an open loop nature to it, and it's relational. And one of the best ways to see it is when you see parents calming down an upset child just with their presence, or by cooing or connecting. That is part of the open loop nature, the interpersonal limbic regulation, if you will. And there's the research around this is really cool. They've shown that you can actually, with your presence, you can alter hormone levels in other people. You can alter their cardiovascular function, alter their sleep rhythms, and alter their immune function. And you can alter it for the better or the worse. And in the world of relationships, hierarchies matter. So parents have a bigger impact on their kids' limbic system than their kids have on their parents. And if you're a boss in an organization, you have a bigger impact on your followers' limbic system than they have on yours. So, if you've ever been in a room and one person yawned, and then pretty soon another person yawns, and pretty soon everybody's yawning, that's a manifestation of kind of the contagious nature of emotions through this interpersonal limbic regulation. And it spreads just like a virus spreads. And if you're a leader, it's kind of like being in the front car of a roller coaster. If your emotions are topsy-turvy and up and down and all over the place, everybody on the cars behind you is going for the same kind of a crazy ride. And on the other hand, if you are cool and calm, everybody behind you is going to be in for a cool and calm ride. And one of my favorite examples is from when I was a street paramedic. One of my bosses was Dr. Norm Dinerman, pictured here. Worked at Denver General Hospital, and those of you who've seen the book, The Knife and Gun Club, have a sense as to what our world was like. And Denver General Hospital was a level 1 teaching facility, trauma center. And so when you'd bring in somebody who was shot or stabbed or bad car crash or whatever it happened to be, there were 20 or 30 people in the trauma room. There was residents and interns and medical school students and nurses and nursing students and paramedics and orderlies and respiratory therapy and x-ray, and the lab people were there. Everybody was all there. And usually when you went in, it was kind of chaotic and fairly noisy and all that kind of stuff, except for when Norm Dinerman was the attending physician in the emergency department. I would bring in somebody with a gunshot wound to the chest, And I'd walk into the trauma room and it would be stone cold silent, absolutely silent. And Norm would ask as we came in, Mike, what do you got? And I would give a report uninterrupted by any of the other noise as we were moving the patient over to the bed, which usually allowed me to do my report faster. And then Norm would say, thank you, Mike. When I was complete, he'd say, anybody have any questions for the paramedic? And if there were no questions for the paramedic, Norm would start to very clearly choreograph, the placement of chest tubes and central lines and drawing of blood and x-rays, and just like a conductor for an orchestra, conducting everybody, and it was cool and calm and quiet. And it was interesting. Some of my friends who worked in the emergency department did a little experiment where they timed trauma patients who came in when Norm was on compared with the other attending physicians who were wonderful physicians. But Norm's patients tended to make it to the operating room faster than the other ones, even though, and probably because of, such a calm, cool, quiet leadership style. So as we come to the end here, if you're interested in learning more about taking care of your folks, my company First Watch has a system called Resilient First, which helps you develop resilience in your teammates. It's got an evidence-based assessment tool, some automatically intelligent powered development strategies that turn your smartphone basically into a resilience coach. The book Supercharge Your Stress Management is helpful. If you're looking for therapy on the other side of things, there's an organization called the All Clear Foundation, allclearfoundation.org on the internet, that has the most detailed set of resources for EAPs and peer counseling and trauma expert therapists, people who understand police, fire, EMS, understand our world. They're extraordinary. And with that, this is my son, Axe. He wants you to be able to stay cool. And thank you very much. Please reach out if there's anything I can do for you or your teammates to help you improve your wellness.